Okay, let's dive into this. Welcome to today's explainer, where we're unpacking a fascinating and honestly deeply impactful report on the unprecedented turbulence going on right now in the British dental landscape. We're going to explore the source material that details the skyrocketing costs of oral health care, the growing crisis inside the state-funded system, and what the article actually calls the illusion of affordable private dental plans. It's a really complex web of healthcare economics and, personal well-being, but we've got everything ready to break it all down clearly for you. To really understand the sheer scale of this issue, we have to start with this massive number, 18 months. To put that into perspective, in 18 months, a newborn literally learns to walk and talk. But according to the source, this number represents the agonizing wait time many NHS patients currently endure just to be seen for absolutely necessary treatments. When a healthcare system tells a patient they have to wait a year and a half for a specialist appointment, well, it essentially forces them into a desperate search for private alternatives just to deal with chronic pain and inflammation. And that insane wait time is largely driven by a phenomenon the text describes as the dental desert. These are geographic regions. We're talking parts of Norfolk, Cornwall, even areas of Greater London, with absolutely zero NHS practices accepting new adult patients. The source points to this as a foundational collapse of the state-funded alternative. It's created what they call a postcode lottery for oral health, where routine care is just completely inaccessible for millions of people. If you happen to live in one of these zones, your local options are effectively zero. Naturally, when the public system is strained like that, people look to the private sector, right? The intent makes total sense. You want predictability, you want protection. But the article outlines what it calls the private insurance trap. While paying monthly premiums of, say, 20 to 50 pounds might feel totally manageable, the source argues that these aren't actually true insurance policies at all. Instead, they function way more like discounted maintenance subscriptions loaded with restrictive small print. So the crucial point is how these policies are actually structured, specifically around something called the annual maximum ceiling. As defined in the report, this is the strict limit, often hovering around just 500 to 1,000 pounds that an insurance company will pay out in a single year. It's actually the complete inverse of normal health insurance, where your coverage scales up with the severity of the issue. This ceiling leaves patients footing 60 to 80% of the bill for major restorative work. I mean, just think about the actual math here. If a patient needs a high-quality single implant in a London clinic that can easily exceed 2,500 pounds, a typical plan might cover just 20% of that. That leaves a massive 80% completely out of pocket. The text notes that this creates a medically disastrous incentive. Patients might actually delay the treatments they desperately need over several years just to maximize those tiny annual payouts. And in the meantime, their underlying bone and oral health just continues to deteriorate. And that delay? Well, it's compounded by what's called the 12-month qualifying period trap. You see, insurers mitigate their own risk by literally forcing patients to wait. Month 1, great, your basic checkup is covered. But by month 6, you're paying premiums and you are still waiting for major coverage. It often isn't until month 12 that you finally qualify for the expensive restorative work you actually need. If you are sitting in pain today, the source argues, this delayed care model is just incredibly frustrating. This combination of inaccessible public care and capped delayed private care brings us to a real emotional rock bottom highlighted in the text, the sudden rise of DIY dentistry. When desperate patients are being quoted 800 pounds for a single crown or facing 8-month wait lists, they're turning to major e-commerce platforms to buy kitchen table dentistry kits, which, let's be honest, sounds like a truly terrifying premise for a reality TV show. The clinical risks of doing this are severe. The source breaks down these medical minefields for us, and it's pretty alarming. First, applying a DIY filling can literally seal in bacteria, causing rapid, painful abscesses. Second, improperly placed materials can alter your entire bite, leading to long-term jaw pain. And finally, these home-use kits can cause permanent tissue damage and actual chemical burns to the gums. The tragic irony here is that a 500-pound saving can rapidly turn into a 2,000-pound emergency corrective bill when these temporary fixes inevitably fail. Which brings us to the core question posed by the source material. Is there a safe, immediate alternative to this broken system? If you need significant restorative work right now, how do you escape the wait lists, the annual maximums, and the severe risks of delayed care? Section 1. The Estesie Alternative, Bypassing the Bureaucracy. The article proposes bypassing local wait times entirely by looking to international centers of excellence, specifically the Estesie Dental Clinic down in Istanbul. They operate on a completely different philosophy. It's a results and precision model rather than an insurance and wait model. The source details a highly optimized, completely frictionless onboarding process designed to treat the patient like a VIP right from the start. Step 1, digital diagnostics, where you simply send over photos or an x-ray via WhatsApp. Super easy. Step 2 is a specialist review, where a multidisciplinary team actually provides a fixed price quote within 48 hours. And step 3 is the VIP concierge treatment, where Estesie handles the whole shebang, from initial high-resolution 3D scans upon arrival, all the way to luxury hotel bookings and airport transfers. Section 2, comparing the real costs UK private versus SC. And this brilliantly illustrates the stark financial realities and price gaps we're dealing with. The driving factor for this massive shift toward international care is, undeniably, the cost. The text argues the UK private market is artificially inflated by high overheads and insurance commissions. Look at these staggering numbers provided in the article. For an initial consult and 3D scan, the UK cost is up to £500. At Estesie, it's completely included. A single implant drops from roughly £3,000 in the UK to around £500. And for a major restoration, like 4 implants and 4 crowns, the UK estimate sits somewhere between £13,000 and nearly £19,000, whereas Estesie's cost is roughly £2,200 to £3,700. The source explains this massive price gap isn't about cutting corners at all. It's because Estesie's direct-to-clinic model and their in-house digital labs eliminate all the bloated overheads and middlemen you find in the UK system. Even when you factor in booking a premium flight to Istanbul and staying in a 5-star hotel, the overall savings still often exceeds 70%. As the source points out, a patient can effectively fund their entire upper jaw restoration for the price of just one single implant at a typical Harley Street clinic. That's absolutely huge. Section 3. The technology gap, modernizing care. Because traveling abroad definitely doesn't mean sacrificing quality. Now, what's really interesting about this slide is the technological comparison. The text states that a lot of UK practices are still relying on traditional, super uncomfortable goop impressions and standard porcelain bonded to metal crowns. Estesie Standard, however, utilizes advanced 3D digital scanners and 100% metal-free biocompatible materials. We're talking zirconia and Emax. These are milled with micro-level accuracy to prevent secondary decay, creating restorations that are designed to last for decades, not just a couple of years. Beyond just the physical materials, the source brings up another really vital component, the hidden cost of time. Time is money, right? For a busy professional in the UK, taking multiple Friday afternoons off for drawn-out multi-stage procedures like root canals and crowns results in some pretty significant lost productivity. This makes the so-called affordable local option much, much more expensive in the long run. To completely solve this, Estes utilizes a highly condensed clinical timeline. Because their specialists and their digital lab are all right there on site, working as a fully synchronized team, a treatment plan that would normally take 6 months of scattered appointments in a UK private practice can be completed in just 5 to 7 days in Istanbul. The article cleverly compares this optimization to the difference between sending traditional postal mail versus using a high-speed fiber optic connection. It's just a completely different league. So, bringing it all together, the source argues that we are currently witnessing a perfect storm that is driving this massive shift in patient behavior. First, UK private fees are projected to rise another 10 to 15% by 2027. Second, severe labor shortages are continuing to cripple the NHS. And third, the Zoom effect has vastly increased demand for aesthetic improvements like smile makeovers, treatments that are explicitly excluded by UK insurance plans anyway. Opting out of this failing infrastructure, they argue, is simply a commercially intelligent decision at this point. We'll conclude our explainer today with this really empowering final thought, straight from the source material. Stop waiting, stop settling for maintenance, start your transformation. It completely reframes the whole narrative around dental health. If high-speed, world-class, and highly affordable care actually exists just a short flight away, why on earth are we still paying a premium just to sit around and wait in pain?